Hello, and welcome to my channel. I've wanted to do a video on the long-term effects of COVID, and since much of the news coverage, at least in the United States, appears to be shifting away from COVID, I thought now would be a good time. So far, an estimated 219 million people worldwide have had COVID. Over 4.5 million of those have died with it, but tens of millions that didn't die continue to have physical, cognitive, and psychological symptoms related to the illness. So I'll answer the questions: what symptoms are most often reported? How often are they reported? And how long will they last? Then I'll review a fascinating statistical analysis from Germany of the effects of COVID on professional soccer players' performance. Over the past 18 months, observational data has been accumulating, suggesting that many patients may experience a wide range of symptoms after recovering from COVID. I first heard it called long haul or long hauler syndrome. You may hear it referred to as long COVID or post-COVID conditions or something similar. But for the sake of simplicity, I'll use the term long COVID. So, even though we're hearing more and more about long COVID, so far there's no widely accepted clinical diagnostic criteria. We aren't sure if some aspects of long COVID may be unique to COVID-19, and many do appear similar to what appears with other viral illnesses or severe infections. For long COVID, we generally mean symptoms that last at least 4 weeks. A search of the medical literature finds dozens of articles documenting the frequency of long-term COVID symptoms. I'll link some of them in the description below that discuss more prominent symptoms. Most are observational studies of the original strain of COVID and not the recent variants. We can break down the symptoms into 2 groups: the physical symptoms and the neurocognitive symptoms. When we look at the most frequent long COVID physical symptoms, fatigue is the most frequent. Up to 87% of those with long COVID report fatigue. Also, it can last 3 months or longer. Obviously, we don't know how long since COVID is a new illness. Next is dyspnea, which is another word for difficulty or labored breathing. Up to 71% report that, and it may last 2 or 3 months or longer. Chest discomfort is up to 44%, cough is up to 34%, and a loss of smell, which is anosmia, just over 10%. Now, the less common physical symptoms include joint pain, headache, Sicca syndrome, rhinitis, dizziness, you see the rest. All are reported at less than 10% of the time, and the duration is unknown. If you think about it, many of these symptoms could potentially be life-altering until they completely resolve, if they ever do. Then there are the neurocognitive symptoms. Post-traumatic stress disorder seems to be the most frequent. Others report impaired memory, poor concentration, brain fog, also anxiety and depression. All of these seem to last for weeks to months after the acute illness. Again, these symptoms improve over time but may persist for more than 6 months for some survivors. And those hospitalized are at greater risk for persistent psychological symptoms. A prospective cohort study by Wong et al., published in the European Respiratory Journal, found that greater than 50% of those in their study of long COVID patients reported a decrease in quality of life score. Multiple studies indicate the long COVID symptoms can affect the ability to function in general. In one study of approximately 1,300 COVID patients that needed hospitalization, only 40% were independent in all ADLs at 30 days. In another study, almost 40% of patients could not return to normal activities at 60 days following hospitalization. In another study of 219 patients hospitalized with COVID, 53% had some limitation on physical performance scores at 4 months. And while data is limited, long COVID does appear to affect children. Now, studies suggest that those more seriously ill who require longer hospitalizations continue to have long COVID symptoms for a longer period of time, but anyone for mild or moderate COVID can have these symptoms. Among a study of healthcare workers in Sweden, it showed that those with milder disease experienced symptoms and functional impairment for up to 8 months after the acute infection. Now, the German study, titled The Long Shadow of an Infection, COVID-19 and Performance at Work. A question that I frequently hear, especially for younger men, is, why should I be vaccinated if I'm at very low risk of severe COVID? I think everyone agrees that the greatest risk factor for bad outcomes with COVID is age. I don't know of anyone who suggests otherwise. But this study looked at men from the Italian and German professional soccer leagues and how having COVID affects their performance. The article puts into context how a change in performance may have regional and global effects on the productivity of other jobs requiring high-level physical exertion. If you want to dig into the details, of course, I'll link the article in the description below. But in short, after shutting down for several months in early 2020, 2 of the professional soccer leagues in Italy and Germany reopened for play. When they reopened, they began testing all players on a week or twice-a-week schedule. Players were quarantined and received appropriate medical care, as you would expect for a world-class professional athlete. 233 individuals who had COVID early in 2020 were identified by name and accounted for 90% of those who tested positive in weekly or biweekly testing. The data was obtained from a sports data company that used video records to gather information for statistical analysis. Data for players who played in each match of the 2019-20 and the 2020-21 seasons were analyzed. The dataset consisted of 72,807 observations from 1,406 players ranging over both seasons. These players averaged 26.5 years of age and a body mass index of just less than 23. The study found COVID caused a temporary drop in performance of over 6% immediately in those infected. Also, that decrease in performance was still approximately 5% at 6 months post-infection. What are the ramifications of this? First, from an athletic competition standpoint, for individual sports, a 5% drop in performance could affect whether an athlete wins first place or is middle of the pack. It is unknown whether the decrease was from physical or neurocognitive symptoms, however. From a public health standpoint, if high-level athletes, who we have to assume are in tip-top shape, experience this amount of functional loss, what about those who are less healthy? What about those individuals in developing nations whose livelihood depends on hard physical labor? Many countries may not have vaccines available until 2022 or 2023, or at least until wealthier countries finish their boosters. Again, many questions and not as many answers. I hope it has provided you with more useful information, though. Thank you for watching. If you like the content I'm providing, please like and subscribe, and have a great day.